Hi, good afternoon everyone. I'm Sandra and I'm doing my third presentation on obesity and cholesterol, how this is affecting children's health. And just to kind of refresh your memories, my first two presentations were about exercise and food and how these two can help lower your cholesterol and kind of help manage it. And today I'm going to be discussing how obesity can increase your risk for high cholesterol along with the medications that are being used for lower cholesterol. And just kind of quick question for you guys. How many of you guys know of cholesterol medications being targeted to kids? Not many people. And this is what I'm going to kind of cover. So just to kind of start off with some statistics. Obesity has increased over centuries, and in the past 30 years it has actually tripled. So in 1980, kids from 6 to 11 years old had a 7% chance of being obese, whether they did a study in 2008 where it was 20%, which is almost triplicate of what it used to be. While for adolescents between the age of 12 and 19, it also increased. It went from 5% to 18%, also from 1980 to 2008. And they did a sample on kids from 15 to 17 years old. And of those individuals who were obese, 70% of them had a chance of having a cardiovascular disease, and this puts them at a very high risk of having and developing further issues. And it's one of the main issues is due to the cholesterol that kind of builds up around the heart and arteries. So some of the long-term effects of being obese is that when a kid at a very young age is obese, they're very likely to stay obese once they're adults if they don't make any changes. Along with that, it increases their chance of having heart disease, type 2 diabetes, high cholesterol, stroke, several types of different cancers, osteoarthritis, and along with hypertension. So some of the medications, like I said, are being targeted to kids. Some of these are statins. There's different types of statins, along with bile acid sequestrants and niacin. I'm going to go into more detail. For your statin drugs, there's 7 different kinds. And what I mean by that, I mean like 7 different layers of strength. So you have one that's a lower strength all the way to a very high strength, depending on how severe your cholesterol levels are. Now, this works by reducing the protein that it is involved in absorbing cholesterol and producing cholesterol. And when you're taking this drug, it helps lower your LDL levels by 18 to 65%, while raising your HDL, which is, if you remember, the good cholesterol, by 15 to 30%. So this is very good, along with affecting and lowering your triglycerides by 7 to 30%. So it does a pretty good job at helping to control it by lowering what you want and raising your HDL levels. Now, for your bile acid sequestrants, this works a little bit different. It actually affects to help prevent cholesterol absorption. So instead of for your statins, it was affecting the protein. This one's just preventing the absorption of cholesterol. And this also affects by lowering your LDL by 15 to 30%, slightly raising your HDL so it doesn't do as big of an impact on your HDL, along with no effects on your triglycerides, whereas your statins did. Now your niacin, some of you may not be familiar, it's actually a B vitamin. It is referred to as your vitamin B3. And there's 3 different types of these drugs. This type of vitamin that they're using, it's 2 that can be purchased over the counter, and 1 that's actually done by prescription, so you need a note from your doctor. And this one is 15 to 25% lowering your LDL, and it lowers your triglycerides by 20 to 50% and raises your HDL. Now, one of the things with your niacin is that it can really be, people in today's, like in the United States, they don't have a problem with getting enough niacin, but it's with trying to lower your cholesterol, they suggest taking extra, so taking the supplements to kind of help affect your LDL, HDL, and triglycerides. And the foods that you can actually eat that help in getting your B3 vitamin is animal products like your beef, your dairy products. This actually is found as your tryptophan, which is an amino acid, which is then converted to niacin in our body. And some of the side effects of all these 3 drugs, the statin, it elevates your liver enzymes in the long-term use. So when you're using this drug, it can actually cause liver damage, which for young kids can be a very big problem, especially at such a young age, and if they're going to be taking this medication for a long period of time. Another problem is myopathy. Sorry, I don't really know how to pronounce it, but it affects your muscles, so it can cause pain in your muscles, soreness, which for kids it can be very painful. Bile salts. The side effects to this drug was it can potentially raise your triglycerides if you're taking this for a long period of time. It also causes gastrointestinal issues, so you can have abdominal pain due to this. As for your niacin, some of the side effects to this is flushing of the skin, itching, changes in your blood glucose levels, so it can potentially cause you to be diabetic, along with gastrointestinal upsets, hot flashes, and palpitations. And for niacin, some of these can obviously disappear if you stop taking the supplement. And some of the other side effects to other medications that I didn't list would be headaches, difficulty sleeping, diarrhea, dizziness, drowsiness, having trouble sleeping, bloating and/or gas, causing of rashes, memory loss, mental confusion, and some of the things to consider before you even, especially for young kids, to start taking drugs. They recommend obese children to lose weight first. See a dietitian. The reason for this is they can help them recommend certain foods to eat to help control their cholesterol. So to kind of start off with those steps first. Limit trans fats along with your saturated fats. Have children eat more fiber and exercise. So some of the things that pediatricians recommend, if it's, if you recommend to take the drugs, is the child has to be at least 8 years and older. They cannot be any younger. They only recommend it after you have attempted to change your diet and exercise, and if this has failed, then this is when they recommend taking the drugs. So it's kind of like one of those last resorts. If everything else failed, you have really high levels of LDL and are at risk, then they recommend the drugs. So just to kind of get an idea from what I've mentioned and kind of get your guys' opinion, with all the side effects and risks, should cholesterol medications be given to kids?
No, I don't think so. I think the risks far outweigh the benefits.
Benefits, yeah. So another question. How should parents help their kids to prevent obesity and reduce cholesterol? Yes.
Force some exercise.
More exercise, all right.
I was gonna say make them go outside and play.
Probably make it fun.
Creating healthy habits, so increasing fruits and veggies,
Okay.
whole grain.
So kind of start off with that whole diet and exercise first.
Just be a good role model.
Okay.
So it's not that they have to really change that much, they're just doing what you do.
Okay. Kind of start off with yourself and then kind of put an example to them. Very good ideas. So a little mini quiz to kind of see what you guys kind of got from it. True and false. Kids need to be at least 8 years to take cholesterol medications.
True.
True. True or false? Medications are used first to lower cholesterol, then exercise and diet are used. False. It's actually diet and exercise first, then medications if last resort. True or false? Obesity increases chances for cholesterol. True. That's the end of my presentation, and from what we've discussed, I hope that you have been able to gather information on whether medications are appropriate for your kids and if they're appropriate for their situations. I hope you found it all very useful. Does anybody have any questions? No? Okay, thank you.